Good afternoon, class. Biochemistry Module 3 for acidosis and alkalosis. Acidosis, meaning taas, ano bo ang pH. Alkalosis, no bo ang pH. So, normal blood pH is 7.35 to 7.45. So, factors affecting blood pH. Number 1, proteins, fats, ketogenic substances, and it tends to acidify blood pH. And the presence of sulfate, phosphate, and hydrogen can cause acidosis also. Kung fruits and vegetables tends to alkalize the blood pH, resulting those fruits and vegetables may contain sodium, potassium, magnesium, calcium, and hydroxide. Also, vigorous exercise, it tends to acidify the pH and convert the ATP to lactic acid, leading to muscular cramps. What is ATP? Adenosine triphosphate, or ATP. This is our energy, no? Kung nagkaroon kita carbohydrates, it could metabolize to form energy. Okay. So, acidosis versus alkalosis. We have acidosis is a condition in which the acidity of blood fluids and tissue is abnormally high. And due to the decrease in normal pH or normal blood pH, major physiological effects in general is depression of the CNS through the depression of synaptic transmission. So gaseous acidosis, more than the normal amount of CO2. Okay, CO2 or carbon dioxide is retained in the body. Example is drowning. So renal acidosis. Renal acidosis means kidney failure. So results in excessive loss of bicarbonate or retention of phosphoric and sulfuric acids. Class, please refer to your modules. No? Patients with diabetes mellitus or DM have a form of acidosis in which sodium, potassium, and ketone bodies are lost in the urine. So we have different kinds of acidosis. We have metabolic acidosis. So occurs when there is excessive loss of bases, which is bicarbonate or sodium, and due to decrease in blood bicarbonate. So there are causes: DM or diabetes mellitus, severe ketosis, eclampsia. Eclampsia is this one. It could you could especially when you are having a baby or before or after, could have seizures during the pregnancy or delivery. We have high lipid diet and urinuria. So the treatment of this one is admission of sodium bicarbonate along with the fluids and other electrolytes. And metabolic acidosis can be compensated through intravenous. When you say intravenous, injection ha. And then respiratory acidosis, hypoventilation, associated with increased level of CO2 in the blood, and then occurring when there is interference with respiratory gas exchange. So carbonic dioxide combines with water to form carbonic acid, and then carbonic acid can dissociate into hydrogen ions, which will lower the pH of the blood. So there are causes of respiratory acidosis. We have depression to respiration and obstruction to respiration. The treatment of this is carbonic dioxide, through oxygen tanks. Acidosis can be compensated through, wait lang, carbonic acid or through oxygen tanks. Oxygen tanks are found in hospitals with a green color nga tangke. Now, we have different kinds of tanks. we have black, we have red, brick red, we have yellow. Yes, and those indicates not just for aesthetic, but somehow your tanks, the color of your tanks indicates what is the chemical inside. No? So the compensation to respiratory acidosis is increase the production of NH in the kidney and increase excretion. We have alkalosis. Alkalosis is a condition in which the alkalinity of blood fluids and tissues is abnormally high, and this rises because of a failure of the mechanism that usually maintain between alkalis and acids in the arterial blood. So associated with loss of acid through vomiting or excessive sodium bicarbonate intake, and due to an increase in blood pH. Major physiological effects over excitability of the CNS or central nervous system through facilitation of synaptic transmission. So types of alkalosis, we have metabolic alkalosis and respiratory alkalosis. Kung sa metabolic alkalosis class, loss of potassium and chloride. So, or the use of diuretics. Anong diuretics class? Pampaihi. Except acetazolamides. Acetazolamides are a drug class. Okay? It's a drug class of diuretics. Drug class na siya, class of pampaihi. So, diarrhea. Kay kung ginadiarrhea ka, galos ka man sang potassium. So, overdosage of alkaline drugs, excessive loss of gastric, hydrochloric acid, and diarrhea. So, we have respiratory alkalosis produced by hyperventilation, meaning dasig ang paginhawa, salicylate poisoning or artificial respirator, which lowers the carbon dioxide level of the blood. Decreased bicarbonate due to hyperventilation. So, compensated by decrease in production of NH4 by the kidney and decrease excretion. Wait lang ha. Respiratory alkalosis. Excretion of carbonious acid through the lungs. So we have a condition where vitamin C was overdosed. So we all know, that vitamin C is water-soluble vitamin. Meaning, hindi siya magstay sa aton lawas. Vitamin C and other drugs like other vitamins like B complex, B1, B6, B12 are all water soluble or water loving vitamins. So when you take it, usually magwa man na dayon. But if you overdose the ascorbic acid, it could cause metabolic acidosis. So metabolic acidosis is this one, no? And mapatay ka. You will die not because of overdosage, not because of the drug itself, but it could cause decrease in BP or decrease in blood pressure. The normal range of blood pressure is 120/80, and if you lower that, it could cause death. So, yes, vitamin C could cause death. No, if you take a lot of it, especially a kid, lain bala class ang dosage sang bata, lain man ang dosage sang tigulang or sang adult. So, especially if you're a kid and you take a lot of vitamin C, like for a day, and then, let's say a bottle, let's say 100, no? So, yes. So, ABG results, Rome, let's not forget the Rome, respiratory opposite, metabolic equal. Okay. Wait lang. So, we have fully compensated, partially compensated, and uncompensated. And please take note of the normal arterial blood and venous blood pH, PO2, PCO2, no? And respiratory acidosis, kung respiratory acidosis nubo ang pH, taas ang PCO2, no? Respiratory alkalosis, taas ang pH, nubo ang PCO2. So, kung metabolic acidosis, nubo naman ang pH, normal lang ang respiratory. Metabolic alkalosis, taas ang pH, normal man japon ang respiratory. Pero, saya nga metabolic, manubo siya. Kung metabolic acidosis, metabolic alkalosis, mataas. Okay. Please take note of the table. It's self-explanatory. Okay, let's go to the collection of arterial blood gas specimen. We have to obtain the vital signs first. Number 2, determine whether the client has an arterial line in place, allows the arterial blood sampling without further puncture to the client, and perform the Allen's test. What is Allen's test? Allen's test is our so-called fist closure test, and it is used to determine the patency of the vessels supplying the hand, and and also the radial and ulnar arteries. So place your thumb over the patient's radial and ulnar arteries and get him to clench his hand 3 times in quick succession. So compress the vessels and ask him to extend the fingers. The hand should be clenched. Now release the radial artery and note whether the return of skin color is delayed for more than 3 seconds. So repeat the test, this time releasing the ulnar artery. So kung ara sa inyong libro, Allen's test is performed before obtaining an arterial blood specimen from the radial artery to determine the presence of the collateral circulation and the adequacy of the ulnar artery. Failure to determine the presence of adequate collateral circulation could result in severe ischemic injury to the hand if damage to the radial artery occurs in the atrial puncture. The nurse first would explain the procedure to the client. To perform the test, the nurse applies direct pressure over the client's ulnar and radial arteries simultaneously. While applying pressure, the nurse asks the client to open and close the hand repeatedly, and the hand should be blanched. The nurse then releases pressure from the ulnar artery while compressing the radial artery and assesses the color of the extremity distal to the pressure point. If pinkness fails to return within 6 to 7 seconds, again, i-3 lang. So, we will follow the module ha. If the pinkness fails to return within 6 to 7 seconds, the ulnar artery is insufficient, indicating that the radial artery should not be used for obtaining a blood specimen. Finally, the nurse documents the findings. Other sites can be used if the radial artery is not deemed adequate, such as branchial or femoral. We have different kinds of arteries that we could perform, no? We could inject. One is kung baby pa, no? Hindi na siya dapat sa kamot. Kay gamay-gamay pa na ang arteries sa kamot niya. So ang ginagamit is in the foot, no? Dara sila ga-inject. So amo na siya. Example, if you are a dengue patient, medyo dehydrated ka. So mabudlayan sila mag-inject. May man tawo like me nga hindi gidya ga-collapse ang arteries or hindi gidya ma-injekan. Sometimes sulod, sometimes hindi. Okay, questions will be followed, or questions will be asked on Friday. And I will give quiz right now for the 3 and 4 until Thursday. So, thank you.